Hallie Jackson, and there is Senator Tammy Baldwin, Democratic senator from the state of Wisconsin. She sits on the Senate Committee on Health, Education, Labor, and Pensions. Senator, thanks for being here. Good to see you again.
Thank you.
I want to ask you about this because and by the way, I'm showing our viewers pictures of various protests. Looks like somebody's being arrested. We've got two people being arrested there for protests at the Senate. They've been growing all day. Senator, let me ask you about this conversation about bipartisanship. The idea that Lindsey Graham says if we don't have a deal by Friday among Republicans, between Republicans, we're going to have to go to Democrats. We've heard a number of senators, including Susan Collins of Maine, saying the same thing. Tell me what the truth is. Are you not participating with Republicans because you dislike the deal so much? Are they not asking you, or are they not allowing you to be part of the process? Which of these three is it?
Yeah. Well, let's be very clear. The people of Wisconsin did not send me to the Senate to take away people's health care. And so long as they're pushing a bill that does precisely that, 22 million people by the CBO estimates of the Senate bill, there isn't going to be any bipartisan cooperation. So long as they insist on trying to notch a partisan victory by repealing Obamacare rather than working across the party aisle to fix it and to grow access and to deal with affordability, whether that's drug prices or premium prices or lowering deductibles, we are not going to have a hand in taking people's health care away.
But from a process perspective, if you take some of these Republican senators at their word that they are really now looking toward the idea that this bill may not pass with only Republican support, so they're going to have to do something. And I don't know whether that means adjust the bill they've got so that people like you might support it, work on a new bill jointly with Democrats. What's the process? Is anybody having that conversation at all?
The process is to start work on a new bill, to discard the idea of scrapping the Affordable Care Act and instead fix it and strengthen our entire health care system. And I think in addition to the need to have a bipartisan discussion, what the Republicans really need to do is continue to listen to their constituents, because their voice is what has led to this delay. You know, health care is personal. I've talked about my own childhood illness that made me labeled as a child with a pre-existing condition who couldn't get health insurance at any price during my youth. I've retold the story of constituents who have been writing me, and I pray they've been writing their Republican representatives also. Constituents like Zoe, a young girl who was born with a congenital heart defect. She had her first surgery when she was 5 days old, and her mother wrote me pleading to stand up for her child and others like
Senator,
her.
To that point, why do you care if Republicans want to rewrite Obamacare if you can be involved in a new bill? Look, you as a Democrat admit there are some shortcomings with Obamacare. Most Democrats I speak to admit that. So why are we dug in about whether it's repeal and a new bill if you can be involved in the new bill?
Because we have to take repeal off the table. It is a partisan gesture. They're just trying to keep a partisan promise that has nothing to do with the health and well-being of their constituents, my constituents. As soon as they take repeal, in other words, a bill that will result in 22 million people losing their insurance, restructuring and slashing of Medicaid, which so many depend on as a lifeline. As soon as they take that off the table, they have willing partners. And in fact, I can give you countless examples of when we have been able to team up on affordability issues. Right now, I've teamed up with John McCain in order to help lower the price of prescription drugs. We've seen exorbitant increases in recent years. They're getting away with recklessness. And I know that across the party aisle, we can do things to rein that in. Those players accountable.
Well, let's hope that's the direction we're going in. Senator, good to see you again. Thank you for joining us. Senator Tammy Baldwin, Democrat from Wisconsin.